They don't run your garbage pickup. They don't decide your parking tickets. But they do run your hospital, your psychiatric care, your ambulances, and your dentist. Ever heard of the Regional Council? Welcome to episode 3 of Vote Home Season 2. I am Nartis Josh Matake and I'm here together with
Derek Hartman, and you're listening to episode 3.
Exactly. We managed to episode 3 out of the 5 episodes. But today we have actually 2 very special guests, and I'm both of them have very, very typical Danish names. So I hope to God that I can pronounce their names. But we have with us the 2 presidents, one president from central Denmark or Midtjylland, Anna Skuhnau, I hope. And then we have the president of the region of the capital or the capital region, Lars Gardhøj, I hope. Welcome to our episode, and please say a few words about yourself, and probably also you can get a chance to actually say properly your name.
Yeah, my name is Anders Skuhnau in Danish. I'm the president of the Central Denmark region, as you said, Narcis. That I've been for 8 years now, and I'm also head of the board of the Danish regions. And the Danish regions is a board for all of the 5 regions, and in the future only 4 regions.
So you're like the president of the presidents?
Yeah, you can say that. President of the board of presidents and other board members. Yeah, from the regions. Yeah,
Nice.
So I live in Aarhus. If all the listeners don't know that, it's the next biggest town in Denmark.
Super. And now let's talk to the biggest town in Denmark.
Yes, hello, Derek and Narcis and all the listeners. My name is Lars Gardhøj, and it's difficult to say, but you did it quite well. Thank you. And I'm the chair of the regional council in the capital area, and as you said, president is actually a better title. So thank you for that. I've been chair of the regional council for 4 years now, and soon we will be running for a new term, Anders and I. But there will also be some changes in the regions, because today we have 5 regions in Denmark, and soon there will only be 4. But I think we'll get back to that later in the program.
Thank you so much for being with us here, and I think it's quite an honor to get 2 presidents to speak English to the international audience. I don't think we ever had that before, so you're making history here today with us. So my first question to you is, what is a regional council? Because people will be going to vote for the local and regional elections. And while people can get sense of local council, okay, it's the local mayor, we had one of those at home as well. Not everyone comes from a country where they had regions or they had to vote for a regional council. So what is the difference between a local and regional council in an easy way, I would say, not in a very complex and political sciencey way?
Yeah, you can say that one of the differences is the size, because the regions are typically much larger areas that they are ruling over. And there is also some differences in the tasks that they manage. We primarily have the responsibility for the healthcare system in Denmark, and we own the hospitals and most of the healthcare system in Denmark, and we make agreements with general practitioners, and we also are responsible the last end for what they are doing in Denmark, and for psychologists and dentists, as you say, and everybody in the healthcare service in Denmark. We have responsibility of the quality of the treatments and so on. So that is our primary responsibility. We don't have legislative powers like they have in other regions in Europe. And as you say, it's not every European country that have regions at all. But it varies a lot between countries which power the regions have, and also which size they have. We are comparable to a lot of other regions in Europe, but still we are smaller because the country is smaller. That's some of the differences.
Interesting. Lars, you were talking a bit earlier that there's a reform going on, that they're cutting from 5 to 4 regions. Can you tell us more about that?
Yes, of course. Today we are 5 regions, and in the future there will only be 4. and this means that 2 of the regions will be won. And it's the eastern part of Denmark. So today we have the capital area, which is one region, small in size, but the biggest in numbers. And then our neighbor region is Zealand, which is a smaller region, big in size, but smaller in numbers. And from January 1st, 27, it will be one common big region covering the whole of eastern part of Denmark. And then it's very technical, but we will have the next year, 26, will be kind of a year where a year of transition. We have to get 2 big regions combined. There's a lot of employees, of course, and a lot of stuff going on. And that's a big task. And then from January 1st, 27, the new region will be running as a new region, but 26 will be a year of transition.
It's almost like a new country, East Denmark.
Yes.
You have enough power and population to secede from the rest of us. Finally, the dream from the capital, right? Because there's always this divide between people living in the capital and people living in Jylland. So now basically you brought the whole capital region and extension of it together. And then there's the rest of us, the north, the center, and the south. Are they planning to unite any more regions, you think?
No, there was a huge political debate, and I think there was also ideas on the table that there could be fewer regions, maybe 3 altogether, but it ended up with 4, and Anders can say more about it. But the thing is that the western part of the country is, even though Denmark is a small country, that's the big part.
Geographically.
I think the eastern part of Denmark, even though we're now half of the country in numbers, I think still Anders' region, Region Midt, is still bigger in size.
Okay.
And I think even the southern region is also very huge in size. I think 4 regions is probably that's how it ended. But I think there was ideas that it could have been 3, but it ended with 4. Maybe Anders will say something.
Yes, that's right. There was some discussion also because the northern part of Jutland, the region,
My part.
your part, region north, we call it, it's quite smaller than the other regions, and the southern region in the country and the central Denmark region are equal in size, and just between the big region, the capital region, and the northern region. So they are now in the future. There will be a quite substantial difference in sizes between the northern Jutland region and the eastern region in Denmark. But it don't have to be a problem. We also see that in other parts of Europe that we have different sizes of regions, both in geographical size and in how many inhabitants are in the regions.
I think it's also because here in the north, people are very proud of their region North Denmark, and pushing us together with the middle and making Aarhus the center and not Aalborg anymore. It wasn't received very well by the locals. Let's just say that.
And I don't understand that, because the central Denmark region is a quite magnificent region. Yeah, of course I understand, because it's very important that you feel represented by the politicians that you select. And the northern part of Jutland is special in its own way, like the other parts of Denmark. There are different cultures in different parts of Denmark, and you have to respect that, I think. When I'm serious, I would say I definitely understand why the northern part of Jutland is their own region also in the future.
So now my question to you is, how many council members will the regions have now? I've heard there's also a change in the numbers, because it used to be a fixed number of 41. Did that change?
Yes. That is one of the things that are changing, because today we have 5 regions with 41 politicians in each region. But in the future, it will be more different. So in the eastern part of Denmark, the east region, there will be 47. That's a huge difference with the situation now, because there's 2 times 41, so there's 82 today. But in the future, there will be 47. So that's a huge difference. And Of course, now 2 months before an election, some of the candidates are worried it's going to be more difficult to get elected, but also parts of the region are wondering, will there be a politician elected in our area? Whether it will be a blue or green or red politicians, that's not the issue, but will there be a local representative in the big council? Nobody knows, because there will be 47, that is for certain, but they can be elected anywhere in the new region. So there are people and that have concerns about the democracy. Will it be representative, or will it all only be the bigger cities maybe running away with all the members? We don't know. I think there will be a pretty good coverage geographically, but we'll wait and see. The voters will decide.
There's not much longer until we find that out, how it functions. But Anas, can you tell us how does it function, the regional council internally? Because I know the local council has a mayor, has aldermen. Is it something similar in the regional council, where do you have like kind of the mayor, which is the president, which is what you guys do? And do you have some sort of people who are like between regional councilmen and the president? Is there any position in the middle, like there is on the local council, the aldermen positions?
We are presidents or chairs of the regional council, and that's like a mayor in a municipality. That's quite the same. We also have some committees under the council. In each committee, we have one person that is head of that committee, and we will have that also in the future. But the new thing with the reform is that we will have some healthcare committees, decentralized healthcare committees under each regional council. And these healthcare committees will have both politicians from the municipalities in that area where the committee have power over the healthcare system. And they will also have some directly elected politicians from the regional councils in these committees. So that's quite a new thing with the reform, and we have to see how that will function. I think it will be very important. But then we still have the regional councils, and we also have one committee under the regional council that is taking care of all healthcare related issues and also all other issues that we, for example, transportation, buses, trains, and like that. So that will be the new structure. So today it's quite similar to a municipality with committees under it and with a chair or a mayor or what do you call it. It's the same today, but in the future it will be quite different.
I'm glad that we mentioned specifically healthcare as one of the main functions that you do. I think when most of us in the international community, for example, think of, okay, what does a regional council person do, or why are these local and regional elections so important? Healthcare is something that comes up most frequently. You mentioned the committees, Anna's, which is very interesting. Could you maybe tell us a little bit more on the role that the regional council plays when it comes to things like, for example, like hospitals, like the planning, construction, staffing, the budgets, the things that we hear a lot about in the news, but maybe at a very high level, sort of the headline level, we hear about this. But how does that kind of impact what you do or what your role is from your level?
Yeah, we have the responsibility for the healthcare system, as you say, and the hospitals are the biggest part of the healthcare system. Around half of the population is visiting a hospital as a patient for one time or more each year. So it's a very big entities, and we have a lot of patients in the hospitals, and we are responsible for the hospitals. We own the hospitals in the regions. So everything from planning to daily functions and decisions in the hospitals, we have the responsibility for that. But we also have the general practitioners and other parts of the more near healthcare services under the regions. And now with the new structure, we'll get even more, though we will be quite near to the elderly care, but the elderly care will still be a responsibility for the municipalities. But we have to work very much together with the municipalities to prevent mostly elderly to come to hospitals. We have to make better diagnosis and treatments to elderly people and others in the primary healthcare.
I know mental health care is also part of the umbrella of these services as well. You're also responsible for those. Are there any challenges that it seems like we hear about these a lot, where there are challenges in the system and things that maybe whether it's wait times or things with psychiatric and the mental health care side? Are there any specific challenges that either of you are facing in your regions? And is there anything that is maybe a difference, whether it's for elder care or mental health services, that may be different challenges in different parts of Denmark?
I can say something on mental health. This is one of the really big challenges in fact in all over the country, especially when it comes to children and young people. There is long waiting time to get into to treatment in the regional psychiatry, and that's the same all over the country. We have invested a lot in our psychiatry, and we are also hiring people all over the country, but we must be honest and say that we see more and more children and young people coming to the psychiatry. And that's also why the government decided, in cooperation with the regions, a 10-year plan to strengthen the psychiatry for children, young people, and also adults. And one of the things we have to do better in Denmark is that we have to see problems on an earlier stage and have a prevention or intervention earlier on. So maybe you don't have to be a patient in the regional psychiatry. That's very difficult. We are working on it in all of the regions, and the reform is also a challenge because up till now the psychiatry has been a hospital on its own, and the somatics hospitals on their own. Now they will be combined and be one hospital. So that's a reform in the reform, you can say, but it is a big challenge in Denmark, as in many other European countries, with a lot of people, unfortunately, having mental health issues. We use a lot of time on this issue in my region and also in Anders' region and the other regions. It's really difficult, I must say.
There's definitely a lot on your plates, of course. I know one of the other things as well is regional development. So the idea of basically the planning and the development for things like education, the environment, mobility, just getting around. Can you maybe give us some examples of those things? Of course, they're not all related to the healthcare system and the mental health, but maybe the things that we don't always think about as far as the regional development plans and things that are going on in the background that maybe don't get as much attention in the media.
One thing is the buses and local trains. This is run by regions, and when you think of buses going across several municipalities, then it's probably a regional bus. So when you go to work or maybe to your education and goes a long distance and go by bus, it's most probably a regional bus, and you don't think about that when you're just taking the bus. But that's one of our more unknown tasks, and there's a lot of local trains also, where the regions they run the local trains. So that's also very important to connect the country and the cities and the more rural areas. So it's probably a bit unknown, but it's a huge task and also a lot of economy, to be honest, and also difficult because public transportation is only getting more expensive, and it's also a challenge to get people to go by the bus. So it's an important task, yes. So that's a bit of the regional development. Maybe Anders can add something on some of the others.
Yes, we also have a task about pollution. So we have to clean up bigger pollutions, but also some pollutions that are concentrating around smaller areas like private homes. So we have to help people get rid of these pollutions. That's one of our responsibilities as a region. We also have some responsibilities in the educational sector, high schools. We have some tasks in this area also. That's some of the areas that we are working in as regions.
Derek, I think we covered what the regional council actually does, and I think it will be interesting to see what both Lars and Anas think about internationals. It's a unique chance to get someone that is in a leadership position within Danish politics to tell us what do they think about the international community. Because do you want international residents that live in Denmark to vote in these elections? Because I know that there is a debate now that should we even be allowed to vote. And I know that's one way that we can influence regional politics, obviously, is by voting. But we haven't really voted in the past years because even though it's a right we have since 1995, it hasn't been talked about very much. I know that because here in Aalborg, we made the first campaign in English back in 2013, when in Copenhagen was not even a discussion about it. Yeah, I'm proud.
So you seem very proud of that.
Yeah. So, but the point is that what do you think about internationals? Lars, if you want to...
Yeah, I think you should go vote. It's your right, and you live here and you participate in the society. You study, you work, you pay taxes, and of course you should vote. To me, it's a no-brainer, to be honest. And I know there's a discussion now, and I'm not part of that discussion because I think it's a right you have. And to be honest, me as chair of a big region, we are very dependent on internationals also to come work at our hospitals and many other places. So yeah, I think it's normal, and you should be proud and go vote and take part. Yeah, that's it.
I totally agree with Lars. Of course, you have the right to vote, and in a democracy, it's very important that the voters use their votes in democratic elections. Definitely go vote for the regional council also, and for the municipalities as well.
But here comes the question from my side. From the regional level, are you able to influence in any way the voting process? Because one thing is to give a right, but another thing is to create a space for it to be used, right? So are either of you campaigning in English or trying to communicate any political messages towards the international community?
No, not too much. I take part today, and I'm also looking for, you can say, international medias in the Copenhagen area, just to reach out and show that I'm around, and also to get people to know that there's election coming up and they have the right to vote. And then, of course, if people are interested, politicians are, as Anders and I, we are very easy to get hold on social medias, and just write an email or write a message or whatever, and we'll be more than happy to answer also in English and maybe even German. But that's it for my part.
Nice.
But I haven't made brochures in English or something like that. No, I haven't.
Okay. Do you have any say into how the voting sections are being organized, or that's a completely local task? Like the voting sections where you go and vote, those are organized by the local level or also by the regional level? Is it a shared task?
No, it's not up to us. It's not a task for the regional council. So no, it is not. It is the municipalities that have the responsibility for the places that you can go vote.
Okay, fantastic. Okay, we talked about voting, and you said clearly that people can reach out to you via social media. But are there other ways that citizens, people who live here in your regions, are able to influence the politics that you do? Is there any other way that a person who is not elected can influence what you're doing there? Any other form?
Of course, you can always contact us, and you can also be member of a party and join the campaigns and just attend meetings and raise your voice and say what's on your mind. In Denmark, we have a very short distance from Anders and I, even though we are nicknamed presidents today. Later this afternoon, we will meet regular people in the streets, and people will say what's on their mind, maybe good, maybe bad. So feel free to just reach out, and there's different ways. Of course, you can be a member of a party, and then you're very close to the politicians, but you can also just reach out, and if you have maybe a meeting where you gather a lot of people, it's easy to invite us, and maybe it's a Tuesday evening, and we would like to attend if it's possible. Of course, now close to the election, we want to meet as many people as possible, but the calendar is also pretty jammed already. But I think if you want to meet politicians, reach out. We want to talk to people. Yeah.
But what can you say about, because I know that there is these public hearings every time you pass a new strategy for the region. You do these public hearings, consultation rounds. I even heard that if you're a patient, you can join some patient boards. Are those ways that you can get involved, I guess? What can you tell us? What are those ways of influencing?
Yeah, that's also a way of influencing to be part of a patient organization. And you can have meetings with us politicians through these channels. So there's a lot of ways to get influence on the politicians. And of course, if you are a member of a patient organization, we will have regular meetings with you. Some of them we will have that. Yeah.
Maybe I can add that, in Denmark, we often say that we are a country of many organizations, and sometimes people organize around maybe their disease. If you are diabetic, or then you can be part of that organization, and other times you can be part of a political party or some other organization that will work with issues concerning maybe health or maybe traffic or maybe environment. So there's many ways you can be active and also be engaged in politics, and some are more direct than others, of course. But I think there's many possibilities, and in general, Danes are pretty nice people and mostly also okay in English. So I think it should be fairly easy to get access.
So one thing that we noticed, and actually was a bit surprising, of course, was knowing that amongst the international community, of course, the level of voter participation is lower than I think, of course, we would like, and lower than a lot of our Danish peers, but also that local elections are getting a little bit more attention. If more people are voting in the local elections than the regional elections, that was a bit surprising, especially because they are held on the same day. So if most people are voting simultaneously for that, it was a bit surprising to learn that the turnout was about 5 to 10% lower than it is for the local elections. Do you have any insights into why people may be less likely to vote for their regional representation compared to their local or municipal representation?
I think the municipalities have responsibility for more areas, for more political issues than we have. We mostly have healthcare. So if you are not so interested in healthcare issues, maybe the regional council is not so important for you. Of course, traffic, as also Lars mentioned, buses and local trains, it's important, but most voters don't know which buses is regional and which is municipalities, and they don't have to know either way. So I think the municipalities, they have more issues, schools, elderly care, and so on. So I think that could be one of the reasons. Maybe also the politicians are more a part of the community they live in. They are responsible for smaller communities than we are. The regional councils, it's more far away from the electors. I think that could be another way to explain the differences that may have some influence on how many voters are actually using their right to vote.
So it's the physical proximity, but also sort of the proximity to the issues in their lives may be a bit to do with that.
Yeah. I might add that I totally agree with Anders, but you could also add that in a municipality, it's often maybe more easy to comprehend the differences, because it's either you are pro or against building a school or building a new city hall or something like that, very concrete, for or against. Whereas in health, it's more difficult, it's more complicated, and it's not black and white. In fact, it's a bit of a paradox, because people always say that health is very, very important. But at the same time, it's a bit difficult to comprehend, and then maybe it's part of why people don't vote, because it's difficult. And I understand that. So we need to be more clear on what's the differences and what's the task we are having the responsibility for. So that's on our part. We have to be better at telling about what we're doing, but also people they should use their right to vote, because Suddenly, if you don't vote, someone else will decide for you. So go vote.
That's a great message.
I'm curious, if you were to say one message to the international community, maybe to convince them to support you, because you're both running for the elections right now, what will that message be? A last message from your side to the community, if you were to transmit, or maybe something you're fighting for that will be specifically helping internationals. Is there anything that you can mention?
On a more general note, the Danish society is an open society. We need internationals. We are happy that internationals want to live in Denmark and take part. Many internationals are working on hospitals and in areas related to hospitals at universities and at life science companies and so on. We need you guys, and I think you should go vote, and you should vote for parties that says openly that we need internationals in Denmark. And that's what I, as a social democrat, are saying. We need you, and you're welcome.
Thank you. Anas?
Yeah, I very much agree in what Lars said. Denmark is a little country. It's a nice country to live in. We are proud of our welfare and also healthcare system. It's one of the most important parts of our welfare system in Denmark. So we need you, and we need also your votes and your interest in what we are working with in the regions to make it better for the Danish people as well as the internationals. So I will also say, as Lars, go vote on the 18th of November.
Thank you both so much for your time, and thank you all for listening to this episode of Vote Home. Don't forget to stay right here and keep it with us in episode 4, where we'll be talking about what you can do if you want to get involved. And you may be surprised to learn that you can run. Really, you can. And we'll tell you how in episode 4.